My name is Clarissa Miller. I'm a kinesiology student at the University of San Francisco, and today I'm going to talk about the ways in which the pandemic of COVID-19 has further exposed and strained our current system of long-term care and the way that the elderly and disabled are treated in these types of particular types of facilities that I'm going to be talking about today is more often than not uncaring and can be neglectful and harmful. So now that we have sort of established exactly what I would like to address today, let's dig a little deeper into exactly what I mean by that and what we can do about it. So first, I would like to establish the seriousness and prevalence of this problem. So when I say long-term care, I am referring to two major options for inpatient elder care in the U.S., which are skilled nursing facilities and assisted living facilities. And some background is that skilled nursing homes are medical facilities overseen by registered nurses and staffed by nursing aides. And this is a system that has for a long time faced issues of inadequate care and poor wages. One research study prior to the pandemic found that 82% of homes had been written up for infection prevention control deficiencies, and about half had persistent problems cited over multiple years. Nursing assistants are commonly and frequently overworked and underpaid. They oftentimes are made responsible for many residents, and it's really hard to, attend to each resident individually in the way that would be best when you are completely overworked. And the average salary is about $30,000 per year. Additionally, large nursing home chains have been charged with fraudulent Medicare billing practices in which they have denied wrongdoing while simultaneously paying tens of millions of dollars to settle these charges. There is also a problematic rating system for these care facilities in which nursing homes submit their own data without any external oversight. The other option that I had mentioned before, assisted living facilities, some background information about those is that they provide far less medical support compared to skilled nursing facilities and therefore are cheaper than nursing homes. The average cost to live in assisted living is about $50,000 a year. The majority of assisted living facilities are also for-profit but paid for out of pocket. They're also a great deal less regulated. So the real issue with this is that we have basically manufactured this system that allows for poor treatment of elder care workers, has loopholes to avoid real consequences. It creates bad incentives, and further, many assisted care facilities combat with poor management of dementia patients' neglect and elder suicide. On the other hand, there is also home-based care. Home-based care is what majority of people who need long-term care actually do in fact receive it at home. And about 80% of care at home is provided by unpaid caregivers. So this is oftentimes family members who want to keep their loved ones at home, cannot afford proper facilities. And so research has shown that this actually totals out to about $67 billion in lost wages. So, however, for those who can't really afford nice senior services or community residential facilities, and for those who don't have family members to take care of them, that is what they are left with for long-term care options, skilled nursing or assisted living facilities. So according to the CDC, this actually accounts for about 2.1 million people in long-term care. And COVID has just exemplified how these facilities can be far from optimal, and most actually did not handle the pandemic very well. In fact, residents and staff make up less than 1% of the population, but account for almost a third of COVID deaths, according to the Kaiser Family Foundation. So not only are we hearing and reading about terrible infection rates on the news, but we also see news such as New York's governor's administration's manipulation of nursing home COVID data. So, as you can imagine, in this already heavily burdened system, and the way this pandemic has affected this particular vulnerable population in general has pushed this system to an absolute breaking point. And so next I want to talk about, why does this matter? Truth of the reality is that there is a good chance that we all may need help with daily living activities at some point in our own lives, and maybe not in our own lives, but in the lives of our loved one, a mom, a grandfather. And so this issue could become very personal when you're trying to plan and find what would be the best solution for your family member. Another potential reason as to why this matters that I want to bring to everyone's attention is that this is an extremely unique opportunity that we are currently in to improve the quality and affordability of care. This is a chance to rethink and redesign long-term care facilities from the ground up, so not only to protect this vulnerable population from future viruses, but also we know this population is aging. We know that there are about 10,000 birthdays every day until the year 2029. We know that 1 in 4 people will be over the age of 65 by 2030. We know that our society will be requiring young people to be able to adapt to helping people over the age of 65. So let's plan for it now. And so what needs to change and what can we do about it? Some suggestions could include regulatory changes and reform at a national level. So regulatory changes to prevent these persistent problems should probably include mandated funds for certain types of care, standardized levels of care, and public funds for home-based care for the elderly. Another factor that is going to be a huge contributor is making this care affordable. So in my research, I had actually found that not many countries have developed comprehensive systems for financing long-term care. However, there are a couple exceptions to this. Germany and Japan both have universal long-term care insurance systems in place. However, if you are a family in the U.S., there is a chance that they pay on average more than $100,000 for a private room. And if you would like some assistance with such a charge in your life, the federal government only assists with those who qualify for their state's Medicaid program. So those are individuals with very low income and assets. Another suggestion is to increase oversight and enforcement. So how are we going to basically force facilities to improve? And beyond long-term care facilities, we also should probably be considering the ways in which we can help people not need facilities like this. So, for example, nursing care is an entitlement under Medicaid, but not home and community-based care. So like I mentioned before, let's take this opportunity to reorganize the way this is structured. So again, amongst the research, I had come across a woman who works for AARP, Deborah Whitman. She is the Executive VP and Chief Public Policy Officer. And she described how AARP had heard from nearly 6,000 family caregivers whose loved ones live in nursing homes and other long-term care facilities, and they heard about their experiences during this COVID-19 crisis. And basically, Deborah describes their accounts as gut-wrenching and truly underscoring the need for major change. She continues by describing a vision of a system that promotes independence, choice, dignity, autonomy, and privacy. and also a system that needs to be fiscally sustainable and affordable for both individuals and the government. We know that people prefer to receive care in their homes and communities, which is also often cheaper than residential settings. So she further explains that by allowing people to be cared for at home, helping people to be cared for at home, we're also helping reduce the risk of contracting COVID-19 or another future virus. And for those who cannot remain at home, we know from COVID-19 that smaller facilities seem to have lower transmission rates, and residents report higher satisfaction as well. So as a part of this rethinking and rebuilding, Deborah believes that the key will be to emphasize personal dignity and person-centered care. So with that said, we have an opportunity. Let's take advantage of it. Let's work together to transform this system, make change for the future, and plan for a positive, sustainable future. And these are my references. Thank you so much for your time.